Hi, everybody. Thanks for taking a few minutes with me today. We have a lot to be thankful for now that it's finally June and the first day of summer is here in a week or so. We have Pride Month, Juneteenth, Flag Day, and Father's Day all in this month to celebrate. I hope everyone had a nice spring and that you're making plans to take some needed and deserved time off from work this summer to be with your family and friends. I want to say a quick congratulations to all the Jefferson employees who volunteered their time to plan another successful June 5th fair at Abington this past week. This fair has a long tradition and is presented by the Abington Health Foundation, Women's Board, and Auxiliaries. I also want to give a quick shout out to the Jefferson Northeast team who recently underwent a successful Joint Commission survey. Not everyone who works in our organization is involved in direct patient care, but everyone plays an important role in caring for our patients. Making sure everyone understands the challenges we face, what leadership is doing to address those challenges, and how we can all be helpful is essential to our overall success at Jefferson. We've been talking a lot lately in town halls and other meetings about the efforts underway to address one of our biggest challenges, especially since COVID came upon us. That challenge is getting control of our patients' length of stay. Today, I don't want to bore you, but I'd like to briefly provide a bit more detail about what this means and why length of stay is so important. To start, length of stay is the total number of days a patient is in the hospital. And it's important because of the impact on patient safety and patient experience, as well as hospital operations and the overall cost of care. Prolonged length of stay and delays in discharging patients impacts the emergency department's ability to treat and care for patients in a timely manner. This is referred to as emergency department throughput. When the beds in the hospital are full, patients in the emergency department who need to be admitted to the hospital must wait in the ED for a bed to become available. We call this boarding. Obviously, this is not the best for patient experience or treatment overall. Most of us know someone who has had this experience in the emergency department, and it's frustrating not only for our patients, but for our ED staff as well. And unfortunately, boarding and long wait times to receive care can determine how the patient perceives the rest of their experience in the hospital. Getting control of length of stay also not only improves the quality of treatment patients receive, but enhances patient experience. The patient's risk of infection, falling, and experience medication side effects are all higher when length of stay gets extended unnecessarily. Prolonged hospital stays can impact the patient's mental health too. The longer the person stays in the hospital, the greater risk for becoming anxious or depressed. Studies show this is particularly true for seniors with chronic conditions and those who may lack family support. Efficient management of beds and patient flow improves patient safety, enhances patient experience, and decreases the overall cost of patient care. Waiting for medical testing and medical assessments and delayed transportation to home are top on the list of reasons a patient's discharge is delayed. Our excellent nursing and care management staff provide each patient and their caregiver information about the discharge process so they can plan for the patient's discharge when their clinical team determines they're ready to leave the hospital. Throughout the North region, we have implemented an early discharge initiative for patients who are clinically ready to be discharged from the hospital. Our goal is to discharge the patients by 11 a.m. Patients at Jefferson, Abington, Montgomery, and Tarsdale hospitals who can move about freely and care for themselves, but are unable to get a ride by 11 a.m. will be taken by patient transport to the newly designated discharge waiting areas to wait for a ride home. We have also put into place several other initiatives throughout the region to control length of stay, including establishing a length of stay task force, patient flow committees, twice-a-day discharge escalation huddles, weekend rounds, and offering Uber or Lyft services when appropriate. The medical teams have also been asked to be very diligent in their assessment on whether tests like MRIs and echocardiograms can be done on an outpatient basis after the patient is discharged home, rather than having the patient stay in the hospital an extra day or two awaiting tests. The nursing and medical staff have an obvious role in patients' timely discharge from the hospital. But if you work in diagnostic testing, environmental services, food and nutrition, patient transport, pharmacy, lab, or rehab medicine, remember you also play an essential role in the discharge process. For the rest of us, telling our family and friends who receive care in our hospitals about the 11 a.m. discharge initiative and reinforcing the importance of having a ride home is much appreciated and very helpful. We will continue to evaluate the process in place, and we welcome any other suggestions or comments you may have to assist in our length of stay initiatives. Thanks again to everyone for everything you do to care for our patients, visitors, and each other.